You walk into the hospital for a routine scan. You're told it's safe, standard, nothing to worry about. But what if I told you? That same test might quietly raise your risk of stroke overnight. I'm Dr. Hartley. And after 25 years in neurology, what I've seen with contrast dye shocked me, especially what it does to aging brains. In this video, I'll show you the hidden biological damage most seniors never hear about, and 5 ways to protect yourself before your next scan. Frank, 72, went in for a simple CT scan with contrast. 2 days later, he was confused, disoriented, and back in the ER. What happened wasn't rare, it was preventable. See, after 60, our brain's protective walls weaken, our kidneys slow, and contrast dye, the kind used in routine imaging, can overwhelm both. That's why today I want to walk you through the 5 hidden ways contrast dye impacts the aging body, and how to protect your brain before your next hospital visit. 1. The safe test that isn't so safe. Frank didn't think twice about the scan. His doctor called it routine, a quick CT with contrast, just to double-check his vessels after a mild stroke. He walked in steady, clear-headed, but 2 days later, something shifted. He couldn't remember his neighbor's name. He felt foggy, detached. At first, they thought it was stress, but I've seen this before, and it's not just coincidence. You see, after 60, your brain doesn't protect itself the way it used to. There's a special wall, a tight barrier of cells, that keeps your brain safe from harmful substances in your blood. But with age, that wall weakens, like a fence that's been weathered by time. Now, here's where the real danger begins. The contrast dye injected during these scans isn't gentle. It's dense, hypertonic, designed to light up your vessels for the camera. But in an aging brain, that dye becomes a kind of molecular crowbar, prying open the fragile gate that once kept your brain safe. And once that barrier breaks down, things start leaking in. Swelling, confusion, even damage that takes weeks to show up. A 2022 study looked at seniors receiving contrast through arteries. Most recovered fine, but 4.5% suffered permanent neurological effects. One patient didn't survive. Now, let me be clear. This isn't about fear, it's about informed protection. Because what Frank didn't know was that sometimes you can say no. Is there a non-contrast option that still gives us the answer? Sometimes yes, sometimes no. But you deserve to ask, to be told your choices. Because that scan, it helps spot the problem, but what happened next might have been avoided. Have you ever felt worse after a hospital test, but didn't know why? Let me know in the comments. You're not alone. 2. Why aging brains react differently. Frank's story stayed with me, but it also reminded me of someone closer to home, my own mother. She was scheduled for a follow-up CT after a fall. Nothing urgent, but when I saw the order included contrast, I paused. Not because I was scared, but because I knew something most people don't. See, as we age, our immune system doesn't shut down. It shifts. It becomes more reactive, more sensitive. A phenomenon scientists call inflammaging. It's like your body walks around with a low-grade fever all the time. Now add contrast dye into the mix. You're pouring gasoline on a smoldering fire. That dye doesn't just illuminate arteries. It triggers a massive inflammatory response. Your immune system sends out messengers. IL-6, TNF-alpha, IL-1 beta. And for an aging brain already on high alert, that chemical surge can tip the balance. One study from 2024 found that blood-brain barrier leakage in seniors was closely tied to this cytokine storm, and more pronounced in men over 60. That means the very scan meant to help might leave your brain more inflamed than before, and yet it's not hopeless. There's a way to buffer the reaction. Before any contrast scan, I always recommend 2 things: water and nature's anti-inflammatories. Hydrate well, ideally 1 to 3 hours before, and in the 48 hours before your scan, load up on turmeric, green tea, blueberries, foods shown to calm cytokines and protect the brain. My mother? She drank green tea with ginger that morning, ate lightly, and asked her doctor if the contrast was essential. It wasn't. They skipped it. And she walked out sharper than she walked in. Have you ever made a small health choice that changed everything later? Tell me in the comments. Your story could help someone else. 3. Kidneys. The silent gatekeepers. Most people don't think about their kidneys during a brain scan, but after 60, they might be the most important organs protecting your brain from itself. Here's what most seniors miss. Your kidneys act like a filtration system for your bloodstream. Every drop of contrast dye injected into your veins has to be cleared by your kidneys, but with age, that process slows down. It's called EGFR, estimated glomerular filtration rate. It tells us how well your kidneys are cleaning house. After 60, that number tends to drop, and when your EGFR is low, even normal amounts of contrast can stay in your system too long. Imagine trying to flush dirty water through a clogged filter. The gunk doesn't go away. It just builds. That buildup triggers something called contrast-induced nephropathy, and CIN, a type of kidney strain that can cause toxin retention, blood pressure surges, and in some cases, stroke recurrence. One study published in the Saudi Neuroscience Journal tracked 246 stroke patients. 8.2% developed CIN, and patients who had had hemorrhagic strokes, their risk shot up 7-fold. Frank didn't know about EGFR. No one checked his kidneys before that scan. A day later, his creatinine levels spiked, and his recovery was delayed nearly a week. Now, here's the takeaway. Always ask for an EGFR test before any contrast scan, especially if you're over 60 or have high blood pressure, diabetes, or take diuretics. And once the scan's done, hydrate. Keep drinking water for the next 24 hours. You're not just protecting your kidneys, you're protecting your brain, your heart, and your independence. Have you had your kidney function checked recently? If not, this might be the moment to ask. 4. The salt surge. Nobody mentions. Frank told me later, right after his scan, his chest started pounding. Felt like anxiety, he said. But it wasn't panic, it was pressure. Most people don't realize this, but contrast dye isn't just a liquid. It's loaded with salt. Some formulas contain 2 to 3 times the osmotic concentration of your blood. That means when it hits your veins, it pulls water, it raises pressure, and in an aging body, that shift can be risky. Now, picture your circulatory system like a dam, strong enough, but worn from time and storms. Injecting high salt contrast is like pumping seawater into that dam. It stresses the walls, it raises the tide, and if your heart's not prepared, things can crack. The Brazilian cardiology study in 2021 found that in older adults, contrast administration led to a sharp rise in systolic blood pressure, and in some, triggered heart palpitations within hours. That's exactly what happened to Frank. 3 hours after the scan, his heart rate spiked. He felt flushed, dizzy. Doctors brushed it off, said it would pass, but it scared him. And now we know. It wasn't just nerves, it was physiology. If you or someone you love is over 65, ask this before a scan. Can we use a low osmolar or isoosmolar contrast? These versions are gentler, closer to your natural fluid balance, less strain, and if your heart's been under stress lately, lower doses, slower infusion, extra fluids. Because when it comes to your brain and heart, the smallest shift in pressure can echo in big ways. Ever felt your body reacting to something doctors said was normal? Trust that feeling. It might be trying to protect you. 5. How to protect your brain before the next scan. Frank had to go back. His doctor recommended a second scan a month later, another look at his carotid artery. But this time, he knew what to ask. He knew what to do. See, after 60, your body doesn't just age. It becomes more sensitive to the little things. The salt in a scan, the speed of an injection, even the timing of your medication. Most people don't realize this, but your kidney function, measured by something called eGFR, naturally declines with age. And when that number drops, contrast dye lingers longer. It takes more effort for your kidneys and brain to clear it out. But there's good news. We can prepare the body for the scan, just like we'd prepare a house before a storm. Step 1. Hydration. Start drinking clean water at least 2 to 3 hours before your appointment. Ask your doctor about IV saline prehydration, often used in hospitals to protect kidneys. Step 2. Medication review. Certain drugs, like NSAIDs or diuretics, can increase the risk of contrast damage. Ask your doctor or pharmacist if you should pause any prescriptions 24 hours before the scan. Step 3. Slow infusion. If contrast is necessary, request a slower injection speed, especially if you have high blood pressure, heart issues, or are over 70. Frank followed all 3. He drank water, reviewed his meds, and asked for a slower delivery. This time, no confusion, no spike, no setback. He walked out of the hospital with a clear head and full peace of mind. Your family needs your wisdom, not your worry. And protecting your brain protects more than just memory. It protects who you are. Frank's story could have ended differently. He could have stayed confused, frustrated, at risk. But instead, he got informed. He asked questions. He made small changes, the kind that protect the brain, not just scan it. And now, that clarity, it's his to keep. Because here's the truth. You don't need a medical degree to protect your brain. You just need information and the courage to speak up, even during a routine test. Comment below if you've ever experienced side effects after a scan, or if you've made a small choice that changed your outcome. Your story might guide someone else. And if this video helped you feel more prepared, hit subscribe. We talk about the small things that protect your big future. Because your brain is more than tissue. It's your stories, your family, your legacy, and it deserves protection every step of the way.